I'm Jessica Walsh. I'm the Executive Director of the Women's Resource Center, and we serve Newport, Bristol County, and East Providence, so the whole East Bay of Rhode Island. We are a domestic violence services organization, so we provide direct services to people who've experienced domestic violence. We are called the Women's Resource Center, and we often get asked if we provide supports to men and non-binary folks, and we do. So we provide services to anyone who has experienced domestic violence in our community. We have been in existence for over 45 years. We were founded in 1977, and we've been providing domestic violence services for that entire time. Now we have a range of services that provide the supports that folks who've experienced domestic violence typically need. So we have an emergency shelter for folks who are fleeing domestic violence. We have transitional housing supports. Often getting back on your feet after experiencing domestic violence is tricky, and so transitional housing helps provide a bridge between shelter and permanent housing out in the community. So we have currently 8 transitional housing apartments that we provide housing and supports to folks in those units. And then outside of our residential program, we also provide counseling for folks who've experienced violence and their children. We also provide court advocacy. We don't have attorneys on staff. However, our advocates are trained to support clients who have experienced domestic violence in the process of obtaining protective orders or dropping protective orders if that's what they need. We are there to help fill out the paperwork, help explain what's going on. We track all of the domestic violence cases in the Newport courthouse, so if we will send letters or make phone calls to the clients to let them know what's happening with their case, so that they don't have to worry about being there every single time there's a court date. These cases often drag out, so our advocates are there to kind of track what's going on and keep the client updated. We also have a law enforcement advocacy program, which whenever there's an arrest related to domestic violence, our advocate can reach out to the victim and find out if they need our supports. We also can answer questions actually for the law enforcement. If they have a tricky case that involves domestic violence, we can help them understand how to respond in a trauma-informed way to the victim in those cases. So our sort of systems advocacy, we call it systems advocacy, department helps advocate within these existing systems for victims who are often in crisis, and navigating those systems when you're not in crisis can actually be intimidating and challenging to understand. And so our advocates are there to really kind of help folks understand what's happening and make sure they get what they need. We also have a statewide program supporting folks who receive cash benefits from DHS who are also victims of domestic violence, to help them navigate that system, to make sure that they're getting the supports that they need within that system. So those are that's the high-level overview of the services that we provide. We also have a very robust prevention program, primarily focused in Newport, and we are working to prevent domestic violence before it starts. And no one is 100% sure how to do that, because if we knew, we would be doing it already. And so we focus on creating healthy communities and addressing the social determinants of health as a way to prevent domestic violence. So essentially creating healthier, more connected, stronger communities. Those factors are all linked to actually less domestic violence happening in a place. And so we are working to try to create stronger, more connected communities. And our focus, it's really, it's work that requires a very place-based approach. So we're focused really in Newport right now, and in the Broadway and North End neighborhoods of Newport specifically. So that's an overview of who we are and what we do. The work has evolved, obviously, in 45 years, but what hasn't is that we're here to provide the supports that folks who've experienced domestic violence need. And many people don't realize this, but 1 in 4 women will experience domestic violence in their lifetime. That's a very high statistic. 1 in 8 men will experience domestic violence in a lifetime. That's still a fairly high statistic. And actually, LGBTQ folks, gender non-binary folks, are actually at increased risk as well for experiencing domestic violence. So it's an issue that, we get funding, for example, from the Centers for Disease Control and Prevention, and people ask why. And it's because it's a public health concern. Like, it's a silent epidemic that is really impacting so many families in our community, and we're here to try to help folks get safe, stay safe, and rebuild their lives. So I'm the executive director. I've been in this role for 4 years now, but for the 16 years before that, I was actually in prevention. So prevention is something that's near and dear to my heart. And I do believe and know that domestic violence is preventable. I probably won't see it in my lifetime. You probably won't see it in your lifetime. But I do know that we can work on it and that we can make really good progress. So there's really interesting research around how do we create communities where violence doesn't occur. And it's really often feels very unconnected, or disconnected, I guess is the word, from domestic violence. But for example, communities that have more tree canopy experience less domestic violence. Communities where the neighbors know each other and support each other experience less domestic violence. So there are somewhat tangible things, right, that we can be working on. So we actually have a grant right now through the Centers for Disease Control and Prevention to work on increasing tree canopy in the neighborhoods in which we work as a long-term, sort of very long-term vision of preventing domestic violence. There's also strong connections between other systems of oppression, and so essentially, domestic violence is about power and control in a relationship between two people, right? And so it's about one person having power and control over another person. In many ways, the oppression that we see in our society mirrors that, just at like a much bigger level. And so we're creating environments where that kind of power and control, power over, is acceptable on some levels, and so when it begins to happen in relationships, is it that surprising, right? And so we are looking at addressing other systems of oppression that create sort of a fertile ground for domestic violence to occur. In particular, obviously, I think is the issue of sexism and gender-based violence. So we have a culture in which you look at the pay gap, like there's all sorts of data, right? Where you look at women making, I don't know what the data is today, but 75 to 85 cents on the dollar for men, or other, issues related to how many CEOs are female versus male, how many senators, decision makers, how many people in power, right? And I think we see all of that connected to systems and relationships where gender becomes the piece that people use to have power and control over another person. Now, domestic violence occurs in same-sex relationships, so sexism isn't the only thing driving it, but it's definitely a piece of the puzzle. And it's probably the most direct or obvious, right? So research shows that as you close the wage gap, domestic violence decreases, which probably isn't that big of a surprise, but we often think of the wage gap conversation as very separate from a domestic violence conversation. And for us, from a prevention lens, the wage gap conversation is actually part of the story, right? If we could close the wage gap and we had policies that really close the wage gap, we would likely see domestic violence go down, because that is what the research is telling us. And so the work that we do in prevention is related to those kinds of policy interventions, those kind of community level interventions. So to get to your point of what tangible things, we in prevention are sponsoring we make the farmers market happen we have a lot of partners that help us. So the Quinton Community Table and other partners on a working group that we manage. We are the backbone for the Newport Health Equity Zone, so we are managing a lot of health equity work in the neighborhood. The farmers market, yes, brings food to the neighborhood, but it also creates community. The farmers market happening in the neighborhood, happening at Minestormy Park, which was a huge struggle early on to even get the approvals to do it. That is a way that we're bringing neighbors together to build stronger communities. So it's a really tangible thing. It's a very long-term investment in prevention, but we know that that's what it's going to take. We also we're working with a group of residents, the local advisory group, to impact the development that's happening in the north end of Newport. So they have pushed through some zoning amendments that increase the incentives to put in affordable housing. We know that affordable housing is linked to folks that are leaving violence having a place to be, right? And so we've worked, the group of residents are really leading the work, but we've supported them kind of behind the scenes on those zoning amendments to increase requirements for usable open space, which could be connected to the increase in tree canopy, which is one of our long-term goals. And also the increasing housing, affordable housing, and increasing resident voice in decision-making processes when it comes to the development that's happening out here through community benefit agreements. Increased civic engagement is also connected to decrease in domestic violence over time. And so we're supporting this group of residents with their goals that are very policy-based at this point, really, and very much connected to building a community in the long term that experiences less domestic violence. So one question we often get is, how can folks help either the resource center or those experiencing violence in the community? One of the things we actually know for sure to be true is that often family and friends or colleagues are the first to know when domestic violence is happening. Folks come to us typically well into the experience of domestic violence. And so it's the role of family, friends, colleagues, neighbors cannot be understated. And so one of the things I often talk to folks about is, if your gut just something doesn't set right with a story that your colleague told you or something you're hearing happening with your neighbor, simply reaching out and not necessarily saying like, what's happening is wrong, but just saying like, hey, are you okay? And when I hear that, I feel X, like whatever kind of way. I feel uncomfortable. I feel worried for you. Is there anything I can help you with? Often, initially, people will shut that down, but what we hear from survivors over and over again is that you've now established yourself as a safe person, that when and if they decide they do need help, you will be on that short list of people that they feel they can go to say, you know what, I need help. Can we figure this out together? And so not being afraid to listen to your gut, to name it. The worst that happens is people are like, whatever. But oftentimes you're establishing yourself as a person who can be trusted, who will believe them. One of the really tricky parts that I think is often missed is that folks who cause harm are selectively violent. So they're often quite charming with everyone else in their lives. And often what we hear is that a survivor will say, no one believes me because he or she is so charming and is powerful in their role, or whatever those reasons are, right? And so it's actually super helpful for that person to understand that there might be some people who will believe them, right? And we're very clear that we will believe them, but they have to get to us. And often, like, it's a friend or a family member who refers them to us and says, hey, like, there's a place you can go for help. And so that's the second thing, is knowing that there's a place you can go for help. Now, we serve the East Bay, but there are domestic violence agencies. We are part of the Rhode Island Coalition Against Domestic Violence. There are domestic violence agencies that serve every single city and town in the state. So whether you go to the Rhode Island Coalition Against Domestic Violence website, or you call the 1-800 number, which is 1-800-494-8100, you will get directed to an organization that can help in your area that does a lot of the same stuff that we do. So I think that's important, is knowing that we're here, knowing what kind of services we provide. It's also important for friends and family to know that we aren't gonna force people to do anything. So sometimes people won't reach out because they think, oh, I have to leave him or her or them. I have to, or they're gonna tell me, they're gonna make me feel bad, or I'm gonna feel ashamed. Like, we are here to hear. If someone wants to stay in the relationship, we will safety plan. So we'll talk about, like, okay, you're gonna stay, how do you feel safe? How do we make sure you can stay safe in that, in the environment? It takes, on average, 7 acts of violence before someone leaves a relationship. We understand that, and we know that with averages, that means some people never leave, and that's okay too. And some people leave, the first time. We're here no matter where folks are on that spectrum, and often we can say that all we want. It takes a friend or a family member or a colleague to say, hey, like, you can go, and they're not going to force you to do anything. They're there to just answer questions and be helpful. So that's a really important piece. And then finally, if you really appreciate the work that we're doing, we are a nonprofit, so we always accept tax-deductible donations on our website. And there are events, and signing up for our newsletter is a great way to stay and just kind of stay up to date with what's happening for us, ways that you can support us, exciting projects that we're starting, and also following us on all the social media channels is a way to kind of stay in the loop on what's happening, and also our policy priorities if folks are interested in getting engaged in state level policy. We have the Coalition Against Domestic Violence has a legislative agenda every year that we are trying to advocate for better policy to support survivors, and you can find that by following us on social media. So those are, there are plenty of ways for folks to be part of the solution, and I think the most important to me is just knowing we're here and not being afraid to reach out to a friend or a family member or a colleague that you are worried about. So something that we're really excited about right now at the Women's Resource Center is that we are in the very early stages of planning a completely new facility. So we, at the very beginning of this calendar year, sold the building that we owned for 30 years on Toro Street in Newport as part of an initial stage moving toward building what we are calling our new campus. So we will be building on Aquidneck Island a campus to include shelter, transitional housing, all of our services, and additional kind of wellness supports, all in one place. So right now we have offices in Newport, in Warren, we have a shelter at another location, we have transitional housing units we rent from other people. When we are done with this campus project, we will have double the shelter capacity that we do right now. We will have double the transitional housing capacity that we do right now. We will be able to shelter folks of all genders in one place, which has been a challenge for us. We also will be pet friendly throughout. So our shelter right now is pet friendly, but we will be able to have more pets and be able to shelter more folks with their pets, which is important. Folks will actually stay in an abusive relationship if they think they have to leave their pets. And so having pet-friendly shelter is really important. So we're super excited about that. It will also allow us to really create an entire campus. Every space with a trauma-informed lens. So when folks come to us, particularly into residential, they are fleeing violent situations. And that means that there are many triggers in the environment that may not be a trigger to me or to anyone else, right? But you can really think about building an environment in a space that is calming, welcoming, quieter. There are some very common triggers we can avoid in the space. And so we are really excited to have a beautiful new facility that is trauma-informed throughout, that is pet-friendly throughout, and that really embraces the survivors in our community in a way that currently we just don't have the space to do. So we're really excited about that, and folks should stay tuned. As I said, subscribe to our newsletter and follow us on socials because I think there's going to be a lot of exciting news coming out as we get that project really underway.
Wow.